Hello, and welcome to the virtual roundtable discussion, Reimagining the Frontline Worker Experience. I'm Karen Cox, Director of Partner Business Strategy in Microsoft's Global Healthcare and Life Sciences team. My role at Microsoft entails working with some of our most exciting partners to explore our customers' biggest challenges in the healthcare industry across the globe, and to evaluate how our partners can help our customers address those challenges using the best innovations in technology. It's my pleasure to kick off an exciting discussion today with Microsoft partner HCLTech and industry analyst IDC. We're going to explore today some of the biggest challenges and biggest technologies to help solve those challenges in healthcare. Let's start with a round of introductions. Joining us from HCLTech is Atul. Atul, could you introduce yourself, please?
Yeah, thank you, Karen. Hi, everyone. This is Atul Kichambari with HCL Tech. I'm the industry principal who focuses on healthcare provider marketplace. I specifically work with some of the largest health systems in the United States, working and crafting with them jointly some innovative clinical solutions, non-clinical solutions, and productivity solutions to bring to market for them and alleviate some of the challenges we're going to talk about today. So I'm excited to share the kind of examples and stories that we have for you so that you can take all those learnings back and apply it to your organization. Thank you, Karen.
Thanks, Atul. Appreciate you joining us today. Arun, how about an intro from you?
Hey, thanks, Karen. Hi, everyone. I'm Arun Bharadwaj from HCL Tech. I'm working as group manager in HCL, and I am a digital workplace practitioner. I work with various customers across different verticals and help them transform their workplace to a modern digital workplace. And I'm also working as the product manager from HCL side on Frontline Worker Solution. So, welcome you all, and I hope the solution in the session itself, right? It is of great value to all of you. Thank you.
Thanks, Arun. And I'd like to also hand things off now at this point to Lynn. Lynn's joining us from IDC. How about a few words of introduction to tell us a little bit about yourself?
Thank you, Karen, and welcome everyone. I'm Lynn Dunbreck. I'm the Group Vice President for Public Sector. I also run the Industry Ops Group as well. I've been with IDC going on 18 years. If you're not familiar with IDC, we are the premier market research and technology firm and work with a number of both IT supplier and IT buyer clients. So very excited to be here. This is one of my favorite topics, one near and dear to my heart. I also run the Connected Health IT Strategies program and do a lot of research coverage around how we could reimagine the delivery of care using various technologies, specifically connected health, but of course, do a lot of work around cloud technologies. And of course, in this day and age, all of my analysts are talking about how AI can improve their respective subsectors and areas of focus. So really looking forward to the conversation that we're going to have today. So I think one of the things that really concerns me, and I think we're really reaching a crisis level here with the growing clinician shortages. These are some statistics that I found, both for physicians and for nurses. If you look at the data, it's, over the next 12 years, we're going to be short nearly 40,000 to 124,000 physicians. And this is particularly acute when you look at primary care and behavioral health professionals, particularly in rural parts of the country. So this is leading to putting a lot of pressure on healthcare organizations, and it's certainly an issue that is front and center for both executive leaders as well as clinician leaders within our health systems. And it's also pretty dire for nurses, and they're really on the front line and spend a lot of time in direct patient care. So seeing that we need 275,000 additional nurses between 2020 and 2023 is really quite alarming. And this is leading to, significant issues, like I said, around burnout is particularly an important topic, But also it's one of the huge factors in rising labor costs and why healthcare organizations are looking to technologies to help alleviate some of these stressors. So it's the burnout that I think is really particularly alarming. If you look at the stats, 53% of US physicians are experiencing burnout, and 23 indicate that they're feeling depressed. Similar numbers for nurses in a survey run by the American Nurses Foundation. 43% felt that had experienced burnout in the last 14 days of when that survey was run in 2022. I'm sure those figures are getting worse day after day. And one of the things that's really quite concerning is because of this burnout, they're leaving their professions that they've invested so much time and energy investing in, and are really wanting to care for their patients. But the moral injury that they face of not being able to do what they've been trained to do because of all of the excess burdens, the increased volumes of patients that they're seeing, many of whom had deferred care because of the pandemic, is all contributing to this feeling of burnout. And they're leaving the profession, and they're not recommending the profession, their chosen profession, to their children. So that's going to create additional pipeline issues. And so I think these are really critical issues that are facing our frontline worker and facing our entire healthcare system, because our communities are seeing these data points. They read about it, and it's not only in the trade press, but it's making its way into the local press. So people reading their daily news wherever they consume it are just seeing these statistics, and it's leading to a sense of distrust and eroding their trust in their healthcare systems. And I think that that's particularly alarming. And I'm really looking forward to the conversation, because I think we have lots of good solutions that we can enable with technology, and therefore reimagine how we deliver care. So I think there are lots of challenges that are facing healthcare organizations, and we do think that technology can simplify things. It's an interesting paradox that we face with technology, because as you can see, some of the legacy systems and EHRs that were, implemented widely during 2009 or after 2009 as a result of the hour and the meaningful use mandates, some of those systems really haven't lived up to their promise. And of course, the shift to from fee-for-service to the value-based care, which I think is very important to our industry, has created a lot of change for healthcare organizations, new processes, new metrics, new quality metrics that they must adhere to. And so, that creates a bit of uncertainty, and moving through those new processes, takes time. And quite frankly, a lot of organizations need to step up their game when it comes to change management. And the same could be said too with accelerating the shift to, a digital first care anywhere mode of delivering care. That's really central to reimagining how we might deliver care moving into the future. But again, it creates a level of complexity for healthcare organizations that require more need for change management, of course. But there is ways that technology can simplify things. Having the appropriate types of technology for care coordination and clinical communication to be able to enhance their ability to collaborate across healthcare ecosystems and their enterprises is very important. Obviously, patients move from their primary care physician to see their specialists. They see, physicians and across multiple care settings within organizations. So we need those tools to have the data follow the patient, quite frankly. So interoperability is going to be an important consideration. Of course, connected health, very near and dear to my heart since I cover that technology, but I think there's lots of opportunity there with using more wearables and remote patient monitoring to be able to provide data to healthcare providers, when they need it and where they need it, and that patient-generated data showing them, what's happening to the patient between their visits. Process optimization is so critical. One of the things that's really leading to a lot of burnout is the administrative burdens that are facing healthcare providers today. And so being able to improve clinical workflows, take out that friction, will certainly help simplify things. And at the core of all of this, in order to make all of this work, we need to be on the cloud, providing data anywhere at any point in time for sound clinical decision making. Of course, security is going to be critical for that. We need to comply with privacy and security rules, of course. That integration and data interoperability, that connectivity, again, getting data at the point of clinical decision making. And of course, today we can't talk about healthcare, reimagining healthcare without a mention of artificial intelligence, natural language processing, and machine learning. So these are all very important tools and technologies that we can use to help, address some of the challenges that healthcare organizations are facing today. So we're just about to launch the IDC Futurescape process. This is a research initiative that we do across IDC. And we publish something on the order to 60 to 75 Futurescape reports. My IDC Health Insights team, by way of example, produced two Futurescape reports, one for life science and one for health. And this prediction that you're seeing here came from our 2022 predictions report, whereby by 2025, 50% of healthcare organizations will rely on hybrid workplaces and models to battle digital burnout, reframe workforce roles, and create seamless employee experiences. And we really think that by enabling these hybrid work models that will address the staff burnout that's happening and create workforce satisfaction. And this is not only helping to create seamless employee experience, but it's also of a benefit to healthcare consumers who during the pandemic became much more used to using video conferencing and other types of tools to be able to see their physicians virtually, and would like to be able to continue to do the same, after now that we're kind of, post-pandemic. So I think that, these hybrid models will really be quite effective, and soon we will see them as just part and parcel of delivering care. We certainly had to initiate seemingly overnight that March 2020 to create these digital workplaces for both healthcare providers and as they saw their patients. But there is definitely, we're seeing that healthcare organizations and their patients still want to be able to have the opportunity to have virtual visits and work in for the healthcare providers to work in a hybrid model. So I think that this is something that we'll continue to see a lot of work and iteration on, particularly as we move to a care anywhere model of care, including things like hospital at home. So we think that there are 4 really key technology trends that will address the frontline worker challenges. First, as I have been talking about, this whole notion of virtual care. And healthcare organizations are teaming up with virtual care providers in many ways to be able to augment their own physicians. You look at the example of being able to have, say, telestroke services. And so you may not have enough neurologists on staff or enough, if you're a rural hospital, may not have really that kind of access to services within your facility. But being able to call out and be able to telemedicine, televisit with a specialist can certainly help, provide immediate care to your patients that really can be life-saving. The whole shift to drip for a stroke, for example, is an important consideration. So we think that that's going to be, we'll see more and more of that. Telepsychiatry is another big area of growth, I think, particularly given the acute shortages of behavioral health professionals, and then the increased incidence of, consumers facing anxiety, depression, a lot of it brought about by the pandemic. Collaborative care technology is another critical area. As I mentioned, that whole ability to be able to collaborate with your peers across the enterprise, whether they're working, within the 4 walls of the institution or they're out in the suburban community in medical practices, being able to communicate and effectively collaborate with them is going to be a very important consideration for, addressing a lot of the workforce challenges that we see. And again, some of the core technologies that are really going to enable this are things like being able, the whole notion of shifting from data rich to data driven, because of all of the because of all of the work that we've done to deploy electronic health records and get data into a digital format, we're seeing for organizations having tons and tons of data. And now what do you do with it? How do you go from being data rich to data driven? I think that's ultimately the end goal for healthcare organizations. And then lastly, the whole notion of using AI to streamline clinical administrative processes.
Thanks, Lynn. What insightful learnings there, and thank you for sharing what you've seen in industry. It's an exciting opportunity to be in healthcare, but also one that presents several challenges as you've shared. Lynn, let's start with you. So you went through several of the challenges and issues that we're seeing, but what do you think is kind of the most impactful to frontline workers right now?
I think a lot of it is the volume of patients that they're seeing, and particularly in light of the shortages that both of us have just discussed, that 2/3 of patients during the height of the pandemic deferred care. Nearly 20% deferred, important cancer screening. So think now of a patient who put off doing that for, 1 or 2 years, and now is finding out that they have cancer. If they had had the screening 2 years ago when it was, when it came up on their time to get your next cancer screening, they might have been found at a stage 1, stage 2. They now might be finding that they have stage 3 or stage 4 cancer. So one, it's a significant health issue, and one that's going to impact their life significantly. Um, but it also is creating more complex cases for healthcare providers to contend with that. So when you marry that with the shortages and the fact that there are patients with more complex care, I think that's probably one of the most significant issues. And of course, leading to patient safety issues, and particularly if they go out on strike because they're trying to get control and get their needs met, which are really important, again, because of the patient safety issues and the burnout issues. I think those are probably some of the biggest issues that are related to, the labor shortages.
Thanks, Lynn. Atul, I'd love to hear from you. HCLTech has been a great partner of Microsoft's for many years, also a leader within many industries, especially healthcare. Had the pleasure of working with your team on many opportunities with customers. Tell me a little bit about what you're hearing as the burning issue or issues of the day impacting frontline workers from some of your customers, or what you're experiencing in industry.
Yeah, absolutely, Karen. Like you rightly said, we work with some of the largest health systems in Northern America day to day, and we have been working with them for a long time as well. So we are very, very close to their daily operations and clinical challenges that they experience, and we constantly try to find solutions to address some of them. One of the things, in addition to everything that Lynn said, that I would like to add here is the mental health issues for and the stress and the work-life balance issues that most of our clinical workforce experience today. We hear this from the clients all the time, and recently we were doing some brainstorming sessions on things that we can do to either address those issues or reduce some of the burden that they're experiencing in this burnout, decade, I would say, so to speak. And they are, they what we do also observe is there's a lot of organizational support that they seek in managing some of these hundreds of tasks and boring tasks, I would say, in a way that they have to do today. What we see is organizations are trying to pivot to supporting them, but they're really challenged to find the innovative solutions there to support that journey. The other thing is that we constantly hear is the clinician workflows, especially the nurses who are the backbone of the healthcare system anyway. Their voices are not being heard by the organizations. The needs and desires, for example, the more efficient processes, the more efficient clinical workflows. They're asking for those. They're asking for more collaboration with extended care teams, better tools to actually seamlessly work through all of these things to efficiently take care of the patients.
Those are some great examples of tool. So I'm hearing some common themes here around kind of leveraging tools and technology to accelerate workflows, to also help teams better collaborate. I'd love to turn now to Arun. And Arun, around some of the themes that Atul and Lynn shared, how are healthcare organizations really leveraging technology to address some of these challenges, whether it's burnout, whether it's more efficient collaboration across care teams? What do you think are some of the opportunities that customers have there or organizations have to help?
See, COVID sort of brought the challenges which healthcare providers they face on day-to-day basis to the forefront, right? Probably now the whole world knows about what sort of burnouts healthcare professionals they face, and it also has sort of brought this specific aspect to the forefront of boardrooms and management's discussion, right? And we are seeing that of late, many of our healthcare customers, right, they are spending heavily in introducing various technologies in the environment. Of course, cloud-based and SaaS-based solutions, they are of great help because just to pilot a technology, right, or introduce a technology, earlier you will have to set up a lot of infra, right, and that would mostly be a deal breaker. But nowadays, you can test technology if it makes sense. You can roll it out to the masses, right, to all the users, or else you can just drop it, right? So it becomes quite easy to maybe experiment with certain technologies. But few of the specific technology areas which we are seeing, right, where customers have highest priorities. First of all, as Lynn mentioned in her opening remarks on the challenges of or sort of unfulfilled promises which EHR systems have brought in, right? Most of the healthcare professionals they complain that EHR systems they have a cluttered and complex UI. They are bombarded with a lot of information, and that information overload doesn't help, right? When they are already burdened. So some of our customers they are trying to streamline this experience, right? Leveraging AI, where AI can help integrate various disparate EHR systems and can create a single consolidated view, and also can help users in maybe seeking relevant information, right, rather than them being cluttered with a lot of irrelevant and excess information. Second, I will say is a very simple solution, right, and very obvious solution, but maybe of late customers have started focusing on it, which is providing purpose-built devices to various users, right? Not all users are same. A user, for example, who is supposed to take vitals, right, or note down vitals of a patient and record them and log in them into system. Maybe they will be okay with a cow system, right? A computer on wheels type of system, which they can take along. They can do all sort of vital assessment, and then they can log in, right? While for a doctor, they might be good with a handheld mobile computer, right? Second aspect is the device is a bridge between technology and the healthcare professionals. You can have a best-in-class technology, best-in-class EHR systems, but if the device is not up to the mark, right, it is not fast enough, the experience is going to be pretty bad, right? So customers are moving away from consumer-grade devices to more purpose-built devices. And third, right, again, Lynn had mentioned a focus on collaboration solutions. So many of our customers, they are investing nowadays on introducing certain easy to use collaboration solutions like MS Teams for that matter for frontline workers, which can help a team, right? Healthcare is a team activity. So you need proper efficient solutions where users can collaborate with each other, they can communicate in real time, they can seek help in real time, and they can access various information in real time as well, right? So that is something which we are seeing. Of course, clinical services that has been there, right? That's not a new trend, but customers nowadays they demand and expect a desk, right, which understands their users, their unique needs, right? Healthcare professionals have a entirely different set of requirement. They use a very disparate and different set of systems, right? So the team or support team should know it, and that also helps in proactive support and resolution of various problems which users might face in hospitals while accessing technology or systems or various platforms from their organization. AI, right? That's I would say it's in a nascent stage. Many of our customers they are experimenting with it, right? In terms of maybe using AI to act as virtual scribe for them, or maybe analyzing a lot of data, right? Huge amount of data for them, right? But I would say it's in nascent stage. Some of the large American healthcare providers or customers, right? They are, of course, flag bearers of introducing such technologies. But as the technology matures, we would see that more and more customers are using that as well. And the last point, right, I would say is which is now fairly mainstream, which is virtual visits, right, or telemedicine. Uh, Large, small, all sized healthcare providers now have their own platforms, and there are certain independent platforms as well, which are facilitating this specific aspect, right, where you don't have to visit the hospital, especially for non-critical ailments, right? So that's a win-win for both users as well as healthcare professionals in terms of cost and experience, right? So these are certain focus areas where we are seeing a lot of investments coming in and experiments or pilots coming in from our perspective.
Thanks, Arun. Those are some great examples. You talked about like physicians being able to check on patients, using a handheld device, or patients in rural areas being able to access care just through a virtual visit. Or I love that idea of real-time care, care anywhere. Lynn also used that phrase earlier, so I thank you for those amazing examples. I'd love to turn things to a tool now that we've kind of heard from Arun how technology is being leveraged by many customers. I'd like to get your opinion. Do you think that the practice of kind of hybrid work models, virtual care, remote patient monitoring, do you think that will continue as we see healthcare trends evolve? What's your thought?
Yeah, Karen, the short answer is yes. We absolutely do see a lot of our clients have when they adopted the hybrid work models, right, during the pandemic last 3 years ago. They institutionalized some of the quick solutions in place. But now what we're seeing is they are on a journey of hardening those solutions and making sure that the solutions that they created in haste is scalable, it's flexible, and it's able to accommodate large number of use cases beyond what we had deployed it for. So that's one thing. The second thing is, especially when we talk about the clinician experiences or the employees and staff experiences of the health systems, we had to, during the pandemic, quickly enable a large majority of their staff to work in remote models, meaning move them away from the highly infectious, high-risk settings for the non-essential workers, right? So there was a huge transformation that happened very quickly during that time. There were a lot of policies and leeways that we had to take along with our clients to enable all that patient care. But now again, like I said earlier, we are revisiting all those policies. We're revisiting all the cybersecurity measures. We are revisiting all the cloud infrastructure, everything that was deployed earlier. And then now we are re-architecting and tweaking it so that it is a sustainable model for future as well. Because the client has expressly said that this is the model going forward, meaning they intend that their workers will be in a hybrid model, right? So they are from one end, from a completely remote model, to the other end where you have everything in person before the pandemic. They want to work in future in somewhere in between, because these pandemics, honestly, this is not the last one we will see. I hope it is the last one, but it is not. We know for sure we need to plan for the worst and hope for the best, right? So it's one of those situations. The second situation in terms of the interaction is the interaction between the clinical care team and the patients, right? So we saw a lot of virtual visits, video visits, those kind of technology that Arun highlighted earlier. Well, what we, I just wanted to give an example of one of our clients, how we worked with them during that process, and now how we are actually scaling that for that. So one of the large North American healthcare delivery organization based out of West Coast, during the pandemic, they quickly wanted to develop a virtual visit for the patient encounters. And what we did was we worked in very rapidly in an agile manner. Within 3 months, we stood up a virtual visit application from the ground up. We piloted that with a very small patient cohort, and then tweaked it, and iteratively and in an agile manner launched it for the larger population. And very soon, the adoption really skyrocketed because of the pandemic, obviously. But I'd be happy to tell you that in last 3 years since we launched this project, and this application, they have about 40 million virtual visits that's already been conducted on this platform. So you can see the huge adoption of that platform, not only during pandemic, but it's a sustaining model that we observe. One of the interesting things also we did in the virtual visit application was using AI and data analytics, we were able to automatically transliterate these conversations into 6 different languages in supporting these patients. And as a result, we were able to extend virtual care for 3 million patients that they were not able to, engage in that kind of a virtual encounter because of the, language barrier, so to speak. So a phenomenal example. The adoption keeps on increasing every day. The second thing I wanted to talk about was about remote patient monitoring programs. Again, Arun talked about wearables and sensors. What we do here at HCLTech is very interesting. Along with the remote patient monitoring kits, which includes the wearables and sensors that get sent to patient at their home, right, to take care of themselves and monitor them. Also, the clinical staff can keep a tab on them, make sure that they are following the health regimen that they were asked to follow, so that they don't show up in the ER or the urgent care centers unnecessarily for the same illnesses. What we have is a patient concierge service at HCLTech, where we support all these programs that the health systems actually launch. But because of the clinical shortages, the nurse shortages, the burdens, and all that stuff, they don't have the wherewithals to take care of hundreds and thousands of patients remotely with the existing staff on hand, because the existing staff is very much focused on inpatient care. It requires a lot more bandwidth to take care of these patients who are outside the 4 walls of the hospital. So our patient concierge services basically does the device kitting. We ship all the devices to patients' home. We help them, support them in provisioning them. Anytime they have a question, we are there ready to support them on that. And then more importantly, we also have clinical staff that can help them in answering some of the clinical questions. So, which is a very interesting offering, right? I mean, you think about the nurses, they want to practice at the top of their licenses, or a registered nurse or LPN or whatever. And if you want to optimize their knowledge and talent, what we have to do is deploy some of the lower expertise talent for the things that they can address very well. So we have coaching, we have wellness coaching, we have folks who can do reminders and nudges to the patients periodically, intervene if there is an escalation within their remote program, so to speak, and then call the attention and connect with a nurse or a clinician virtually as needed. So automatically, what we can say is a nurse taking care of maybe 100 patients in a remote setting could, with our services, we could actually scale it to up to 1,000, 800,000 patients by the single nurse, right?
I love that, Atul. Atul, you started off by kind of sharing an example of how quickly technology could be adopted at a healthcare organization, but also carefully, right? Like looking at a pilot cohort of patients before rolling it out more broadly. I love that last example about the remote patient monitoring and leveraging devices also to monitor care. As you think about kind of the marriage of technology and care anywhere, care at home, I'd love to kind of hear your thoughts on equity. We saw a lot of examples of how during the pandemic access to care could affect people in rural communities, people of color. What are your thoughts on how technology can help address some of the disparities we see in equity of care?
Yeah, absolutely, and it's a area that we constantly get in conversations with the clients about how to address the health inequity, so to speak, in our society today, right? And there's a lot of food and shelter insecurity right now at the severely disadvantaged population, if you will. A lot of the rural population, urban population needs some of these basic facilities beyond the healthcare, which kind of hampers them consuming the healthcare services and improving their health outcomes, right? Our clients' health systems are working with a lot of community and social organizations and government entities to address some of these vulnerable populations' social needs. And we as technologists, as a technology company, we are supporting those initiatives by bringing solutions which can actually speeding up the process of adoption of some of these newer care models, if you will. One of the things that we just talked about remote patient monitoring, but a similar trend along the same lines is patient-centric home care. A lot of the folks who are disadvantaged actually can improve the outcomes using patient-centered home care. One of the things that we can do with technologies is to provide them tools, processes, sensors, and telecommunication channels to monitor them, but also to support them, help them with their self-care under the remote supervision of clinicians, right? Wearables, sensors, video consultations, and self-education portals, if you will, mobile apps, all help them in stay healthy at home, so to speak. Simultaneously, what we can do is we can leverage tools like CRM and portals and maybe a lot of different data sources and data integration engines to create a very effective population health and case management solution. Leveraging analytics, we can help in building appropriate patient cohorts. Maybe we can identify social gaps like food deserts and figure out where do we need to deploy resources or call the attention of the social workers where to focus more so that they get the biggest bang for the buck, right? We can also embed clinical evidence-based care plans that guide the care management pathways for each of these patients. And then using data analytics solution coupled with data from multiple social determinants of health data sources, we can create alerts, emails, SMS messages for nudging the patients and empowering them to stay on track for recovery. I would like to cite a quick example here, Karen, of a large project that we did last year. This is an organization that supports veterans' health and their families. Veterans, as you know, have a disproportionate need and they're disproportionately predisposed to chronic conditions. But they receive most of their medical care from civilian facilities, right? And the problem with taking care of veterans in a civilian facilities is it's not very properly trained and aware of the veterans' unique needs, right? So the client approached us and said, okay, hey, we need a solution to address some of these issues. And we worked very collaboratively with Microsoft so it was a three-way collaboration, if you will, HCLTech, Microsoft, and the client, to come up with a solution that was very modern, cloud-based, agile, and deployed to help this veteran community, so to speak. So we basically wanted to equip all the stakeholders, in this case, multiple hospitals, medical personnel, non-medical staff. We wanted to provide them skills and information necessary to improve long-term health outcomes, right, while treating veterans and their family. So we architected the new solution, health management platform, if you will, to connect and coordinate care across healthcare providers. The platform was built on Microsoft Azure, which consisted of Azure Data Factory pipelines, a learning management system, dashboarding, analytics, and reporting modules. We also leverage Azure Fire and API services to ingest maybe say hundreds of data sources, in supporting the billions of transactions that's needed to actually take care of these patients in this civilian environments. And now the platform is actually today helping improve the healthcare outcome for millions of veterans and families. A fantastic case study, great project, showcases the power of technology, modern technology, to support the disparities in and health inequalities, right? Another quick example, if I can, is to talk about one of the clients who's basically one of the largest community and healthcare organization. They have nurses and clinical staff who visit patients at their home and take care of them, especially in the remote areas, in the urban areas. And what they wanted to do was, it was getting very complex for them to schedule these nurses and visiting staff in the most efficient manner, right? Because there are so many different variables you have to consider when you do the scheduling and get the most optimal output from that. So we leverage Microsoft Dynamics 365 platform and healthcare cloud platform to come up with this sophisticated scheduling application. And as a result of that, they were able to improve the number of patients that the clinical staff was able to go visit in a day. Tremendous productivity improvement, tremendous amount of health outcome improvement. And it was a major milestone for us, at least from a personal gratification perspective, for me at least, because we were able to really serve the unserved population, if you will. So with that, I'll hand it over to you, Karen. But I just wanted to highlight those things because this is a very important topic and very near and dear to my heart.
Yeah, thanks, Atul. Some wonderful examples there. Especially, I love the veterans example there. A population that is, often underappreciated, under-recognized in terms of their challenges in the healthcare system. So, thank you for sharing that example. And then you mentioned several amazing technologies that you and your team were able to leverage for your customers. I'd like to kind of turn things back to Arun. Arun, AI is super hot right now, right? There's so much excitement, but also some hesitation about where to start. For organizations that are joining us today, do you have some examples of use cases that are kind of leveraging AI technologies where you think organizations may benefit?
Yeah, Karen, you are absolutely right. There is an excitement, but a mix of apprehension, right? There are a lot of concerns on data privacy, right? When customers hear about generative AI and all those platforms, but many of the flag bearers, as I mentioned, right, especially in North America, they have started experimenting with certain technologies and they're working on certain use cases. Of course, others would follow, right, once they have more confidence in the technology, right? Few of the focus areas or technological use cases which we have observed across different healthcare providers is like first, a few of them are piloting on a concept called like generative AI for medical imaging interpretation. What they do is they leverage the technology to fill in certain gaps, right, in medical health record of a particular patient, right? And leveraging it, right, they are able to improve the diagnostic accuracy and efficiency. So whatever we as humans, right, we can't maybe figure out or predict, the algorithm and the AI platforms are able to do that, right? And that is an important use case probably for the humanity, right? Second, right, many of the customers they are experimenting with ambient technologies, and that has sort of become commonplace even in our consumer lives, right? Voice assistants, recognition softwares, right, and different sensors, right, which we have all across, right, everywhere nowadays, even in our homes, right? So some of our healthcare customers they are experimenting with it. Uh, it can greatly reduce the burden on healthcare professionals, right? They are required to constantly look at screens. If I try to give an example of an ICU, right? People who are responsible for that ICU, they will have to look at the consoles. There might be multiple patients there, right? And it is quite hectic and exhausting thing to do, right? But what AI can help you with is if there are any issues, any outlier data, right, or any problems, so you can be alerted in real time, and it frees you from having to look at all those screens all the time, right? Similarly, if you have to query something, you can check with the certain AI systems. For example, in last 24 hours, how many times a particular patient had irregular heartbeats, right? And the platform would quickly generate a report, right? They can process a large amount of data quickly, and then you don't have to look at the ECG pattern, right, for whole 24 hours, right? It makes again life very easy for you. So that is another use case which we believe, right, would be commonplace. It greatly reduces the burden from the frontline healthcare providers. Another use case is using generative AI as a virtual scribe, right? Many of the frontline workers, especially the nursing staff, they complain that a lot of their time goes into sort of clerical stuff, right, where they have to log patients' details all the time, many times a day, and it wastes, not waste, right, but it takes their lot of time, right? So if you have virtual scribes, they can quickly take notes. You can dictate, and they can just write the notes according to your dictation, right? You can use speech to text like AI platforms. Similarly, it can also record various conversations between a doctor and the patient, right? And it can generate a summary of that as well, right? So that is another use case I can think of. Uh, one of the important ones, right, which again is coming to my mind is ability to predict an event, right? Uh, there is a lot of data, right, in terms of patients' health. There is a genome data, then there are precedences, a lot of case studies. They can all be fed into a system, and the platform can predict a particular event, right? Humanity still doesn't have that much of confidence, right? So we are still in pilot phase where we are trying to see how much accurate these platforms are, and they have shown tremendous results, right? They have found to be very accurate to start with. So these platforms can help team prepare better, right? If the platform suggests that a particular a patient might deteriorate in next 2 to 3 days based on all the data, right? They can prepare an alternate course of action, and it can save a lot of lives, right? So that is another use case for AI, right, which is being experimented with in various environments. And the last one, right, is on virtual reality. We help, or we are working with one of the healthcare providers to create a virtual operations management training, right, for their staff, right, how to manage a hospital, right? And we would gradually extend it to other roles in that organization as well, right? So that is another use case. A similar one can be on the side of the patients, right? Some of the patients, for due to like different reasons, they might be immobile, they can't go out, they can't experience the real world. So VR can help, right? It can go beyond the routine pharmacological treatments. It can help users view the outside world, or the patients view the outside world, and can probably help them in soothing their pain a bit, right? Feel more connected to the external world, right? So that is one of the use case, right? VR ones, we are doing extensively with many of our customers, right? So uh, it's an exciting stuff, right? Exciting domain to be part of. But most of the customers, they are very cautious, right? Especially on using generative AI. But we believe that as the technology matures and customers have more confidence, we would see more and more use cases coming out of this domain.
Wow, thanks, Arun. You really kind of run through a wealth of examples there, ranging from language learning models all the way to kind of virtual assistants, AI to help train employees. There's no shortage of places to start. So I'd like to kind of close out our time together and talk about kind of where do organizations go from here. So if I could, I'd love all of our panelists to maybe give me one maybe suggestion or one place they think that healthcare organizations should get started. We've talked about the importance of data interoperability. If you're leveraging AI, you need good quality data to train that AI. And we've talked about kind of the importance of all of these technologies to support staffing. So I'd like to kind of maybe go back to where we started, which is with Lynn. Lynn, tell me a little bit, maybe just pick one thing you think healthcare organizations should do today.
Right? So many great examples, and it would be so easy for healthcare organizations to run in 100 different directions. So I think part of it is going back to the beginning, and is what is your organization's mission? As you start to think about using technology to reimagine the frontline worker experience and evolving how care is delivered, what is your organization's mission? And then being able to clearly articulate that and start to think about the strategy of and the technologies that you need in place to do that. I would also look just real quickly at some of the best practices. Atul and Arun mentioned a number of examples of their clients doing phenomenal things with technology. And so that's healthcare being risk adverse, looking what others have done to leverage their expertise and their best practices and lessons learned, I think are some very important things, along with change management. I think that that's an important consideration as well.
Great, thank you, Lynn. Arun, any one thing you think organizations should start with, or maybe explore?
Yeah, sure. Just to add to what Lynn mentioned, right? Of course, first or starting point is to assess the need, right? And as she mentioned, you might run into 10 different directions, but you need to have a technology roadmap, and then you can prioritize your investments accordingly. Maybe a simple collaboration-based solution, right? It might be the most pressing requirement, and you can start with it, right, rather than going to like complex technologies like generative AI and so on. Another point would be to involve the frontline workforce in the whole process of rolling out the technology, right? It cannot just be an HR or business initiative. You need to uh, seek confidence from the actual frontline workers, take their feedback, and then fine tune the technology aspect of it. And maybe again, important consideration is to keep your technology rollouts user friendly, right? If the technology is not user friendly, we have seen in the past that the adoption doesn't picks up, right? And then the whole initiative fails, right, on its face. So the solution needs to be very easy. It should take into consideration the backgrounds of different frontline workers. Not everyone might be tech savvy, and it should not be cluttered and should not have information overload, right? As we are trying to solve that challenge, right? So these are some of the starting points I think organizations should think of.
Great additions there. Especially love the point about bringing in your frontline workers to be part of that journey with you and getting their insights. Atul, I'd love to kind of close this question off with you. What are some things you think healthcare organizations should explore? Where should they start?
Yeah, it's a great question, Karen. And I think Lynn and Arun have already covered the things I wanted to say. I'll just say two things, right? One is from a business strategy, digital transformation strategy. Most of the clients that I work with and our organization works with, they have a fairly well-defined business strategy for what's going to happen in the next 1 year and 3 years, right? The alignment of the IT strategy has to be very tightly coupled to that, because without the business strategy alignment, most of these projects will fail to deliver the outcome that they desire, and it doesn't really help the bottom line of the organization. So, for some of the smaller healthcare organization clients that we work with, that's the first question we ask: what is your business strategy and what is your digital IT strategy? And have them been aligned. So we'll validate and verify that. So that's my first recommendation. Always do that. Number one. Number two is, in terms of the IT technology strategy, my advice is, there's a lot of upcoming new technologies coming up. AI is generative AI is so much hype right now and talked about right now. A lot of promise, but you have to sort through all of that. The biggest challenge for most of the IT organization is to keep the lights on today as they are, and the same resources also need to respond to new solutions that the business is demanding, right? So prioritization is the key. The themes in the IT technology where they have to start thinking about is the adoption of cloud technology. The second is really looking at the data that they already have that's omnipresent in the entire enterprise today. How do you get the data governance and the data structures harmonized and start leveraging that data to effectively run your business, right? Not only financial insights, but also clinical operations and other things, which includes patient engagement and stuff like that. And the third thing is, do not forget about cybersecurity. We didn't talk a whole lot about that, but it's very imperative and critical that you have a very strong foundation around cybersecurity. If you don't have that roadmap today, which is well validated by outsiders and experts, I think my recommendation would be do that the first thing. So I think that's two or three things I would definitely say, Karen. I think those are most critical ones. I would encourage all my clients to look at first.
Those are wonderful suggestions. We didn't talk about security, but I love that you closed with that. That's an important one as healthcare organizations across the globe are under attack, with protecting their sensitive patient data, their financials. So thank you for leaving us with that final thought. And I'd like to thank all of our guests today. Lynn, thank you for kicking us off with such insightful learnings about what's going on in industry today and what healthcare organizations are trying to address. And then Arun, thanks for lending your technical expertise and Atul, your business expertise and your client examples. I really appreciate the time. And to our viewing audience, thank you for joining us today. I'm going to hand things over to Lynn just to kind of close things off and then hand things back to our HCL team for any final remarks.
Sure. Thank you so much, Karen. This is really fascinating. I've learned a lot today in terms of great client examples from HCLTech, and we'll very much be following up with them to have further conversations with them and their clients. I think really the future is here today. I've been in the industry 40 years, and I couldn't be more excited and more optimistic about how we can apply all of these great technologies, and especially as they begin to mature even further, like the generative AI and the AI technologies that Arun was telling us about, great use cases there. I think the time is now that we are actually in a position to be able to effectively apply technology, to be able to redefine the delivery of healthcare and improve the frontline worker experience. So super excited about where the industry is heading.
Oh yeah, absolutely. Thank you, Karen. Thanks, Lynn. So as we discussed today, right, the healthcare organizations are under tremendous pressure. They need to reduce operational cost, support stressed out clinical workforce, while also they need to improve the clinical quality and patient experience. That's a lot to ask from a healthcare organization and the CIOs. Technology is an enabler for that. It has potential to alleviate all of these challenges. However, it's also rapidly changing, and IT teams are struggling to manage their daily operations and keeping it running smooth. But at the same time, also innovate and create solutions that are needed by clinicians, right? So it takes expertise to bring technology like cloud, AI, cybersecurity together to make an impact on the finite organization's bottom line. Like they say, it takes a village to raise a child, right? It definitely takes all partners, vendors, and people to run an efficient IT organization. So we at HCLTech, we are the one of the industry leaders in IT services. We are about 220,000 employees worldwide. We operate in 60 plus countries. A very strong foundation in IT. We have some industry leading solutions that are built on modern platforms like Microsoft Azure, Microsoft Health Cloud, and others, which are aimed to reducing cost for you and improve the reliability and scalability of your IT operations. We definitely would love an opportunity to engage with you, explore potential use cases, and craft technology solutions that aligns with your priorities, right? And with that, I would say on behalf of HCLTech, thank you for your time today. And if there's any follow-ups or any additional information you would like, we would be happy to connect with you and get that going. Thanks.